Hi, Becca.
Yeah.
Hi, nice to meet you. I'm Hannah.
Hi.
I'm going to be your occupational therapist.
Okay.
So, how are you doing today?
I'm doing pretty good. How about yourself?
I'm doing good, thank you. I heard you just came from an appointment with your doctor, and he diagnosed you with radial nerve injury?
Yeah.
Okay. Did he kind of explain what that was, or?
I mean, a little bit, not really.
Okay. So, I have a little diagram here to help you out a little bit. But basically, so what your nerves do is they go from your spinal cord all throughout your body, and they're just there to send signals to your muscles and your skin, and they're there to help you out. And the nerve that we're going to be talking about today is your radial nerve. And your radial nerve starts kind of up here in your armpit, and it's going to run along the back of your arm.
Okay.
And then it comes and it runs through the top of your arm. So it goes around your elbow, through the top of your arm, into your wrist and your hand. And in your hand, it helps these three fingers right here. So a lot of times when people have pain or anything, they feel it sort of here. And basically what this nerve does is it helps extend. So your tricep is in the back of your arm, and so when you extend your elbow, the nerve sends signals there. It also comes along the top of your arm, and you have extensors for your fingers and your wrist up here. So extending your wrist, extending your fingers like that. And when this nerve is damaged, those signals aren't sent to these muscles. So we tend to get what's called wrist drop. And so your wrist kind of goes down like this because the nerve isn't sending signals to the muscles, so the arm isn't able to extend and the fingers can't extend. So that's kind of the basis of your injury. How did you do this?
I dislocated my elbow.
Okay. Yep, that's a really common way to get this injury. A lot of times, fractures, dislocations, also compression can cause injuries like this. And what kind of symptoms have you been having?
I definitely have numbness in my fingers, weakness in my wrist, and then just not a lot of mobility anymore.
Mm-hmm. Okay, yep, those are also very common symptoms. Like I said, people feel that, entangling in these three fingers, weakness of just the hand and the wrist. And then again, that just wrist drop is kind of another symptom that we see a lot. So I'm going to be your occupational therapist after your surgery. And before we kind of go into the game plan, I was wondering if you have ever had occupational therapy or if you know anybody.
I have not, actually.
Okay, so basically what our goal is to get you back to doing your everyday activities after you're done. We want to make sure that your routines aren't really thrown off because of this, that you're able to do things like getting dressed, whether it's just being able to pour a cup of coffee in the morning, whatever's important to you. We want to make sure that you're still able to do that. So what kind of things do you like to do at home or
Well, I'm a teacher, so
Okay.
I definitely do a lot of writing on a whiteboard, smartboard.
Mm-hmm.
I also coach gymnastics, so definitely a lot of wrist motions with my girls that I'm coaching.
Mm-hmm.
So.
Okay, yeah, so writing and stuff like that's probably going to be a little tough, so we'll work on ways to sort of adapt that. And also just, I think it's important, I'm sure you'll still be going to work, but we don't want you, supporting anybody or anything like that with your wrist. So now we're sort of going to go into the game plan.
Okay.
And this is about 8 weeks, give or take. It's not always that, but this is sort of the protocol that they have. So to start out, within 48 hours of surgery, you're going to have some suture removal, and then what we want is to start doing some scar massaging just so that scar tissue doesn't build up, so you don't lose any range of motion in your wrist. So that's going to be really important. And then about 10 to 14 days after your surgery, you're going to come back in, and I'm going to take off kind of the big bulky dressing that you have.
Okay.
We're going to take that off, and then I'm going to put a light sort of compressive dressing on. And basically what that's going to do is it's just going to help control for edema, and edema is just swelling, basically. So we just want to make sure that your arm isn't swelling up too much, and if it is, this is just going to help keep it in control so the healing process goes smoothly. And then what we're going to do is we're going to fit you for a splint. And the splint that you're going to have is kind of funny, but your wrist is going to be up at about 30 degrees like this. And they do that because it's going to release some tension here. And so that nerve that they just put back together isn't going to be pulled on or anything like that, and it's going to help heal a lot quicker.
Okay.
Also, we're going to talk about a couple different exercises that I'm going to have you do with just your fingers. And this is just to make sure that you have, range of motion still, a little bit of strength, so your fingers aren't completely useless once you get out of it. And this kind of sounds like a lot, but I'm going to ask you to do these 6 times a day for 10 minutes.
Okay.
So that's about an hour of just finger exercises. But it's really important for you to do these so you heal properly. And I recommend that if you can find a way to get these into your daily routine, that can be really helpful. So doing things, like doing it right when you get up and before you go to bed. Okay. There's 2 times you have it done. If you like to watch any morning shows or anything, you could do it then. There's 3 times. Do it at lunch. That's the middle of the day. 4. And then you just have 2 other times that you have to figure it out. So just finding whatever works for you. I have found to work for previous patients.
Okay.
So does that all make sense?
Yeah, that definitely does.
Okay, awesome. So then what we're going to do is week 4, you're going to come back in and we're going to adjust your split. So instead of being at 30 degrees, we're going to drop it down to 20.
Okay.
And that's just to sort of lengthen your wrist out and those muscles out a little bit, but not too much, where it's just going to cause too much trauma and re-injure. So that's what we're doing there. Week 5, you're going to come in, and we're just going to lower that again to 10 degrees, which is barely anything, but it's just, to make sure that we're not sort of straightening your arm right away, and we're going to injure that nerve.
Yep.
So those 2 make sense.
Yep.
Week 4, week 5, we get to week 6. If you're feeling good, if the healing process is going well, we're going to be able to remove that split.
Okay.
And then what I'm going to do is I'm going to give you some exercises for your wrist. And these, again, you're going to do 6 times a day for 10 minutes. And if you already have like a set routine, just doing those in that same routine and you should be fine. And what we can also do if you're healing well, if you're feeling good, there's not too much pain, we can start to work on hand strength. So, just to get a little bit movement back because you'll be in a splint for, at that point 6 weeks. And this can be things like just using like Play-Doh or putty and just kind of manipulating it in your hand, moving it around. Some people also like to use like hand exercisers that they have at home that you just squeeze together. Other people like to use like hand weights that are just super, super light. But if you don't have either of those, don't worry about it. Don't go out and like buy anything expensive. We can find ways for you to do those.
Okay.
So does that all make sense for week 6? You're just continuing the splint and then getting some new exercises?
Yep.
Okay. Awesome. And then we're going to get to week 8. So week 8 is where if, you're feeling good, the healing is doing well, your nerve is okay, then you can return to work.
Okay.
And we usually recommend that people do a work conditioning program, which is basically, just making sure that you can do things that you would be doing every day at work. So if you're at school, if you have to do a lot of writing or you have to do a lot of typing, just making sure that, you don't have any pain when you're doing those. You're especially going to want to be careful when you're at the gym. Just, you really don't want to push yourself past the point of pain.
Yep.
So that's sort of the game plan for those 8 weeks. Do you have any questions regarding those at all?
No, that all looks pretty good.
Okay. How about just in general? It's a lot of information.
Yeah, I mean, is there anything that I can do to prevent this from happening again?
Yeah, definitely. So, again, we're just going to want to keep sort of that range of motion. You don't want to go too far with it, especially right after you come out. So just really not doing anything past the point of pain because at that point you've probably re-injured it. You also, just thinking about what you're doing every day. So tasks that you might be doing a lot. So if you're at work and you're typing a lot, you don't want to be in that position for too long. Or, you're at the gym and if you're doing a lot of repetitive motions, you want to be careful with that. So finding ways to kind of split your tasks up into smaller portions is really helpful, and that's definitely something we could talk about once we get to that point.
Okay.
And another thing I like to mention is just being cautious of any like compression that could happen. So again, if you're doing a lot of work in one position, or if you're sleeping, do you usually sleep like in a certain position?
On my side or stomach.
Okay. So on your side, what you could do is when you're try to lay on your left side, so you're not laying on your arm.
Okay.
And when you are on your left side, just kind of putting a pillow or something under you to support your arm, just to keep it up there. And what you could do if you're laying on your stomach, you just want to be really, really try to be cautious about not laying on top of your arm, because that compression could also re-injure your wrist or your nerve. So just if it's I don't know how comfortable that would be, but just making sure your arm isn't tucked underneath you is going to be really important. And then just throughout these weeks, if you have any pain or anything, there's definitely like ointments and stuff that you can put on. If you have any like ibuprofen or anything like that. But if at any point it's like really painful, I would definitely recommend connecting with your doctor again, just to make sure that nothing else is going on.
Okay, perfect.
So do you have any other questions?
I don't think so.
Awesome. Well, I will get this handout printed out for you so you can take it home.
Okay.
And if you have any other questions or concerns, feel free to contact me. Otherwise, I will see you after your surgery.
Perfect. Thank you.
Thanks for coming in.
Thank you.